Hi, welcome to Unacademy. This is Unacademy for Doctors, your education biochemistry. Um, Let me just check if I'm visible and audible to all of you. Check if the live stream started on Zoom. Okay, great. Is my voice audible? Let me. Yeah. So, I'm together for the on this channel offering by especially dedicated to MBBS Prof 1 and Prof 2. Here we the learners MBBS curriculum arm you with nuggets with different of advice as to how to write answers, how to advise about attempt your MBBS professional also to give you an early kickstart for your PG entrance exam preparations. All right. In light of the the unprecedented increases of COVID-19 scenario, I have been classes to educate all of you and spell rules regarding COVID-19 and taken a course on pathological investigations for COVID-19 that are very, very important for biochemistry point. The principle behind RT-PCR, rapid antigen extreme will be asked in your MBBS curriculum as well as in your PG entrance. So please go back and revise that. This is the second class in continuity, and this will focus on the radiological investigations, most importantly HRCT, that is high resolution CT scan. All right. So let's begin. I'm Dr. Shivangi Shukla. Most following me on Academy have subscribed to this channel. Haven't, then please, because we cater to whatever your demands are, whatever your doubts are. Our prerogative is to solve your doubts and to design our classes based around your needs and preference. Okay, so please follow us, subscribe to this channel so that we can design our classes based on your preference. I'll quickly take you through the different types of subscription that are available on the iconic as well as the plus subscription. Plus subscription gives you access to video lectures from top educators across the country. You can access their classes while on any device of your choice. Get your tablet, your laptop, file, whatever you need. You can also attempt live quizzes, and you can use different state of the art technologies to attempt the polls or your doubt feature. Talk to the educator live. All right. Iconic subscription comes with access to resources not just from Unacademy, but also from Ladder. That is why it is rightly called best from of the best. In view of the rising COVID cases, most of our learning shifted towards the online, and rightly so, because it is in the best interest of public health. So I would advise you guys to check this out, check the subscription out, because Unacademy offers one of the inexpensive subscriptions. These are quite inexpensive. On top of that, you can get an additional 10% discount to apply my code RSHUKLA Dr. Shukla. This will fetch you an additional 10% discount over and above the already subsidized price. Alright, now this was what we had discussed here the last class, pathological investigations. RT-PCR, we had discussed the principle behind RT-PCR, the application, where is it, shortcomings of RT-PCR, discuss the rapid antigen test, clearly where it can be used, why where can it be better than RT-PCR in which settings, and where can it be not as good as RT-PCR. So these were the most important topics. You should especially remember the principle behind these two from the point of view of biochemistry. It's extremely important, guys. It will this thing is going to be asked again and again in different subjects. So please be thorough with the principle behind RT-PCR as well as rapid antigen. Rapid antigen test involves ELISA technique, immune chromatic assay technique, and RT-PCR is polymerase chain reaction, reverse transcription polymerase. Be thorough with what reverse transcription, thorough with what polymerase chain reaction is. Understood or not? Got it? Check if you are, all of you are following. I should not be blabbering about with no response from your end. Let me just know if all of you are following what I'm saying. Check if my video and audio here. Okay, great. So now what we'll be starting with are the radiological investments. The most important one is, what is it? HRC. Is it HRCT? Okay. What is HRCT? Can you tell me the full form? What does this abbreviation stand for? Is what is abbreviated into HRCT? It is high resolution computed tomography. A high resolution computed tomography. What does it view? It is excellent for viewing the lung parenchyma. Now, before the advent of COVID-19, were rampantly we were using HRCT very common for one type of diseases that were interstitial lung disease. Okay, because it views the lung parenchyma and the interstitial at a very high resolution. Okay, so HRCT was very useful for interstitial diseases and for viewing lung parenchyma. Alright, but after COVID-19 has come, HRCT has also been utilized here because it also primarily affects the interstitium COVID. Okay, so whichever disease affects the interstitium will be best observed on HRCT. Alright, now what are the advantages of HRCT? What are the features? HRCT is a highly sensitive investigation. Meaning sensitive, that there will be very less false negatives. Okay, false negatives will be very less. That means it will whoever is negative on it will be most probability not suffering from COVID-19. What RT-PCR does is RT-PCR has some degree of, it has lower sensitivity compared to HRCT. What happens to people who are diagnosed with on RT-PCR, but in reality they are actually COVID positive. So the main utility of HRCT comes when it should not be universally used. That means for every patient who is confirmed COVID-19 RT-PCR, you should not go about getting HRCT done. There is no harm, but the resources are limited. The HRCT does not utilize a lot of radiation, no. But especially for asymptomatic individuals, it is a complete no. There is no need for getting an HRCT done for asymptomatic individuals. HRCT can be done for those who are suffering lower respiratory tract infections. The dose of radiation, as confirmed by radiologists, is not in the unsafe category. It is completely safe. In fact, serial HRCTs have been really done for a lot of parenchymal lung diseases. Okay, so it is not that the dose of HRCT is in unsafe category, but the thing is that since it exposes the body to radiations, and any unnecessary testing in an asymptomatic individual is of no use. Okay, it is only going to put strain on the resources and unnecessary exposure of the body to radiation. Okay, even though mild, but still. All right. So where does it find most utility in diagnosis of COVID-19? There are two areas. One, it is used for to know the extent of the disease in a person suffering from moderate to severe COVID, having breathlessness, okay, and other lower respiratory tract symptoms. Also, to determine the prognosis. Prognosticating is a very, very important utility of HRCT scan. Okay. Second is since it is highly sensitive, it is more sensitive than an RT-PCR test. So, whosoever is negative on, but the doctors have a high degree of clinical suspicion that person suffering from COVID-19. In those, the disease can be confirmed with HRCT if the person has features corroborating with that of COVID-19. Then he can be labeled positive on HRCT according to the CORAD score that will be coming across later. Okay, understood? So these are the utilities of HRCT. Got it? So what are the utilities? We'll see. First of all, in prognosis, determining the prognosis. Okay, then severity of the disease is almost similar to this. Third is confirm COVID-19 RT-PCR negative cases. Not all RT-PCR negative cases, but in those RT-PCR negative cases with a high degree of clinical suspicion of. Understood? Got it? Any doubt? Shall I move further? Doubt? Should I wait? Should I move further? All right. Next. So HRCT is conducted. Why? I have to. What is the utility? That. What does it view? That also have. What are the abnormalities that can be seen on the HRCT on the high resolution scan of the chest that will be significant of COVID-19 disease? The most common abnormalities are the ground glass opacity. The ground glass opacity. Okay, they are the most significant abnormality. Also, one very, very important characteristic term is the crazy pavement pattern, crazy paving pattern. This is also characteristic of COVID-19. Crazy paving pattern or crazy paving pattern and ground glass opacity. These are the two most important characteristic findings of COVID-19. Okay, got it. Now the other findings can be ground glass opacities plus underlying interstitial thickening. Best of interstitium is best of the HRCT. So underlying interstitial thickening, secondary the localized inflammation, the viral viremia. Next will be focal consolidation. First there will be ground glass opacities. Next, ground glass opacities will be associated with interstitial thickening. Then that thickening is going to increase further and will consolidate at different foci. Okay. Then that consolidation upon increased inflammation, increased viremia. The inflammation is the response of the immune system against the virus, and the immune system tries and contain the virus inside. So to contain the virus, the immune system is going to increase fibrosis so that it envelopes the viral particles and the destruction that the virus is causing. So that enveloping is called fibrosis. Now this fibrosis is going to decrease the elasticity of the lung tissue. It's going to decrease the elasticity, therefore it will decrease the functional capacity of the lung. Got it? Fibrosis is induced because it is a type of protective response against the viral load, but it leads to decreased elasticity and in turn decreased functional capacity of the lung. So the patient, even after full recovery, the fibrosed areas are permanently damaged. This also happens in interstitial lung disease. Fibrosis of the lung is similar to cirrhosis of the liver. It is like complete destroyed, and therefore that part of the lung does not take part in air exchange, gaseous exchange. Therefore, the functional capacity of the lung is reduced and the SpO2 is reduced because the whole of the lung does not take part in gaseous exchange. Okay? All right. Bronchiectasis. Bronchiectasis is also a very common finding with COVID-19, as also with any other interstitial. Okay. And then Hyalure Lymphadenopathy, that is the lymph nodes present at the hilum, they enlarge. Hyalure lymphadenopathy so be mistaken, can also be confused with pulmonary TB or pulmonary pox. It is also a very, very important finding in pulmonary pox. So it should be differentiated, especially because patients with pulmonary pox are low on immunity and they tend to have overlapping diseases. Okay, all right. So go through all these findings, important findings. I'll give you most important finding is what ground glass opacity. Okay, now so these were the findings. Now you should, what is the most distribution? That means where will these findings be present? Mostly signify to be typical of COVID, typical of COVID-19. Where will these findings be present? They will be typically bilateral, okay, multifocal, that means they will be present in different areas, different foci, not be limited to particular areas. Subpleural means just beneath the pleura. Subpleural is extremely important. Almost characteristic subpleural ground glass opacity. Almost totally characteristic of COVID-19. Okay. Subpleural interstitial thickening. Subpleural interstitial thickening associated with calcification. This can be seen in old cases. So again, there is some sort of confusion and overlap with TB. Okay, pulmonary pox. All right. So one should be very, very particular, very, very careful diagnosis, right? And peripheral. Peripheral is also very, very important. This will differentiate it from TB. All you should see ground glass opacities, crazy pavement pattern, this underlying interstitial or focal consolidation or fibrosis or bronchiectasis or hyalure lymphadenopathy. Okay. Sometimes pleural effusion is also seen. Pleural effusion is very commonly seen with pulmonary pox, but pleural effusion is rare with COVID-19. It is only present when COVID-19 is highly severe. Okay, got it? So pleural effusion with COVID-19 is not usually seen. It is present on severe COVID-19, whereas pleural effusion is quite common with pulmonary. Understood? Now, must have come across the score called CORAD score. How many of you about CORADs? Do let me know in the comments section. In the live chat, do let me know. How many of you have come across the CORAD score? Anyone? Let me know what does it stand for. the CORAD score is similar to the BIRAD score. Okay, the CORAD score is the coronavirus reporting and data system. It is just like you must have heard about the breast imaging reporting and data system. Similarly, this is the coronavirus reporting and data system. Okay, so what does this do? This CORAD score is determined upon the HRCT. Upon seeing the HRCT film, the radiologist determines the CORAD score of the film of the particular patient, that is the coronavirus reporting and data system score. What is the significance of this? It determines the likelihood of the patient having COVID-19 based on the lung findings on HRCT. Okay, so if the CORAD score is 0, that means the likelihood of the patient having coronavirus on HRCT is 0. Depending upon the HRCT is 0. So this is how it is graded. So depending upon the presence and the distribution of the different findings on the HRCT film, the patient's film is graded as CORAD 0, 1, 5 or 6, and it will determine the likelihood, the chances of the patient having COVID-19 depending upon the lung finding. What is it? What does it stand for? Coronavirus reporting and data system. Got it? Now, what are these different CORAD scores? See, CORAD 0 is non-interpretable or scan insufficient. What does it mean? Going by the findings of the scan, it is not possible for you to come to the diagnosis whether the patient is having COVID or not. So the scan is insufficient. It needs to be repeated again. Okay, so the scan is not interpretive. All right. Then CORADS 1 is significant of very low suspicion for COVID-19. Very low suspicion for what? COVID-19. Why? Because CORAD stands for Coronavirus Reporting and Data System. So the suspicion and all that here is specifically for COVID-19. So depending upon the lung findings, by the lung findings RCT, it is very, very unlikely that the patient COVID and the lung findings are that of a normal lung or non-infectious. That is cases like ILD, interstitial lung disease. Okay, they will also have ground glass opacity, crazy pavement pattern. So depending upon the distribution of that, it can be put into CORADS 1 with normal or non-infectious lung picture. The lung picture is either that of a normal lung or not that of COVID, because CORADS is only concerned with putting it into COVID or not COVID. It is not diagnosing. This is not used to diagnose. It is just used to tell whether it is COVID or not. Okay. Now, CORADS 2 means low suspicion. That means this suspicion is slightly higher than this, low suspicion. It is typical for other infections. So here the lung is not has some kind of, and it is low for COVID. That means infection is not COVID. The lung is infected, but there is some other type of infection. Here the suspicion is very low. The lung seems to be normal, or there is a very less chance of it having some disease, but that too non-infectious. Okay, it can be what? It can be either an old TB scar, a healed TB scar, anything, maybe a healed lesion, or maybe some parenchymal lesion that is non-infectious, like different types of ILDs, interstitial lung disease. Okay, CORAD 3 is equivocal. That means it may or may not be COVID-19. It can be other diseases also, but these two had totally ruled out COVID-19. This one cannot rule out COVID-19. Okay? can be COVID also. This finding, there may be some ground glass opacity present peripherally, there may be some that are present inside. Okay, there may be subpleural thickening, but it can also be accompanied with calcification significant of old lesion. So it is not very sure whether this is due to COVID or due to some other disease or due to some infectious condition, but it can be COVID. This is not ruling out the possibility of it being COVID. So if it is COVID, then so the presence of COVID starts from which score? CORAD's 3 score. Always remember. The presence of COVID starts from CORAD's 3 score. Then CORAD's 4 is high suspicion. That means now the suspicion for other diseases has gone. This is most probably, in all probability, this scan is suspicious for COVID. CORAD's 5, the suspicion is very high, and the radiologist is sure that this is typical for COVID. There can be no other disease that shows this picture. The picture is typical for COVID. Okay. Then the last one is CORAD 6, which is something else. It is proven COVID. Okay. This is RT-PCR positive for SARS-CoV-2. Suppose some person who has already got an RT-PCR test done has been posted for the Hrct scan and he is positive on the RT-PCR test. So irrespective of the findings on the Hrct, he will be put under CORAD 6 category because he is a proven case of COVID. And what is the objective of CORADs? Objective of CORADs is to tell whether it is COVID or not. Okay, so even though he has no findings on Hrct, still it will not be CORAD 0 or CORADs 1. No, it will be CORAD 6 only because he is proven positive on RT-PCR. The significance of CORADs comes here. Just try and understand. CORADs is not to tell the severity of the disease. No, CORADs does not describe the severity of the disease. CORADs just tells the likelihood of the presence of the disease, whether the disease is present or not. It may be severe, it is just going to tell you whether the particular findings in the lung are due to COVID or not. Be it mild, be it moderate, be it severe. Irrespective of the severity of the disease, it is only going to tell you about the likelihood of the disease, of the findings on the lung parenchyma belonging to COVID-19, attributable to COVID-19. That is it. So if the radiologist knows from before that the person is having RT-PCR, then there is, even though the lung is totally fine, it is totally perfect, the CORAD score is not going to be 0, the CORAD score is not going to be 1, which is normal. The CORAD score is going to be 6. Understood why? Very important. CORADs is going to tell you whether the disease is present or not. It is not going to tell you the severity of the disease. Okay, so even an asymptomatic individual who is RT-PCR positive, if for any reason undergoes an Hrct scan, his CORAD score is going to be 6. Always remember. Alright. So you can go through this again. I'll keep this for 2 minutes. Just read this, try and understand. Okay. CORAD 0, not interpretable. Scan insufficient. It should be repeated. CORADs 1, very low suspicion for COVID-19, the normal or non-infectious. CORADs 9, low suspicion for COVID-19, typical for other infection, not COVID. CORADs 3, the scan is equivocal, may or may not be COVID-19, can be other diseases also. CORADs 4, high suspicion for COVID-19, suspicious for COVID-19. CORADs 5, very high suspicion for COVID-19. The findings are typical for COVID. CORAD 6 is a proven case of COVID-19 because he is RT-PCR positive for SARS-CoV. Understood? Totally understood this. So these were the radiological investigations which are extremely. Go through these again and again. The findings, where they are distributed, extremely important. And then go back and revise from my earlier lecture, revise the rapid antigen test, the principle behind the test, the principle behind the RT-PCR test, okay? And please go, if you haven't checked out my latest special class on the Unacademy app, you can go and watch the recorded session. Tonight, I took a special class on how to read biochemistry for increasing efficiency. It is not just confined to biochemistry, it also involves reading the entire curriculum of studying the entire medical curriculum in such a way which will increase your efficiency, which will increase your productivity, not just for your professional examinations, not just for your PG entrance, but also for you in the long run as a great clinician. You will remember whatever you have read, and most importantly, remembering, you will know how and when to die and when to on your, okay, because that is the most important quality clinician. All right then, guys. So I hope you have understood this. I hope you have taken cognizance of the radiological investigations, which are of a lot of importance. What is the importance? What is the significance? What is the application of the HRCT scan? What are the different types of findings on the HRCT? The distribution of HRCT scan in COVID, how to differentiate findings in COVID and COX TB, and what is CORADS 19? What is the significance of CORADS 19? What does it not show? What does it show? What are the different types of CORAD scores? They are not very difficult, very easy. Please try and remember them. Okay. All right then. So thank you for your patience, and for you being such an amazing audience. If you haven't subscribed to this channel, please do, for notifications of regular classes, and I shall be resuming with the focus series. Tonight also I took one series in the evening on nucleic acids. If you haven't watched that, then do go back and watch. That is an introduction to nucleic acids. It involves the structure of different nucleic acids, how nitrogenous bases form sides and then nucleotides, what are the different bonds involved, acid anhydride bond, glycosidic bond, and different other things. Okay, how is the DNA packed in the chromatin? What are histones? What is summer? All these things. What is linker DNA? Very, very important. So please go back and watch that session. Then day after from and then we'll be starting with different other sessions. Integrated sessions are also on the way. Different educators. Then foundation series, ATCOM series, focus series that will base or that will be comprehension. All these things I'll be regularly taking. I'm taking a medical marathon session on CQ. It's called CQ bonus biochemistry sessions MBBS on an. Please follow me on and do subscribe to this channel Unacademy Doctor for regular updates, notifications for all my classes. Okay. Thank you guys. Bye bye.